So just a quick background to the objective of this session. This session is to look at the advantages of the platform approach for development funding and programming. The session will demonstrate how a platform can extend long beyond the typical project timeframe, allow for multiple investors, and serve as a sustainable, cost-effective solution on a variety of health and development challenges. Global health and development investors typically provide project awards that last 3 to 5 years. At the end of the award period, progress pauses while the investor decides whether to keep funding the project or go in another direction. This time-bound project approach works in some cases, but to achieve sustainable, cost-effective impact across a variety of global health and development challenges, a platform approach is needed. Session speakers will explain how a global development platform creates a multi-layered ecosystem for scaling sustainable solutions. They will also address opportunities to incorporate cost efficiencies and cost effectiveness, the larger at scale and coverage. So with that introduction, I'd like to start by introducing our panelists. And our format will be such that after I introduce the panelists will then give us a description of how their organization is operationalizing the platform approach. And then we'll move on to the next panelist and to the end before we settle down for questions. So our first panelist to my left is Dr. Frank Strelo. Frank is the head of Sustainability Pharmaceuticals Division of Bayer AG. Frank took over the position as head of sustainability at Bayer AG Pharmaceuticals in July 2018. His department is operating several international programs in the context of access to medicine and the UN sustainability goals. Example, in the areas of neglected tropical diseases, family planning, non-communicable diseases. He is a chemist by training, and being with the industry for over 25 years, he has been working at Bayer in different roles with the pharma, marketing, and sales organization at local, regional, and global level. Let us welcome Frank.
Thank you, Kojo. Thank you, ladies and gentlemen. Perhaps I should shortly explain about Bayer because we are an unusual contributor, perhaps a little bit. There is one situation where I have to explain what I'm doing on a very short, in a very short time frame. This is when you go for immigration at the US border. So why are you here? For business. What you're doing? Pharmaceuticals. What sort of pharmaceuticals? So now is the question, what do you say to get quickly through the immigration? Aspirin. That's what people know. In this audience, I would certainly not say aspirin. I would rather say microgynon, or I would say Mirena. So these are the sort of products we provide as a global market leader in hormonal contraception for many years already. And also for many years, we provide them at lowest cost for UNFPA, USAID, and NGOs. So we are a contributor as a supplier to the ecosystem of family planning. And that's deeply in our genes because we're doing this in 60 years. And we have stepped up this by and by. And the most recent activity in that regard, in the supply regard, was that we are providing also now Mirena to the product catalogs. We stepped by and significantly in the last 2 and 3 years, we try to change our role by going from a donor perspective, from a supplier perspective to an additional donor perspective. And that came from the insight that the company, which is not only pharmaceuticals, but also agriculture, consumer health, has a significant impact on the planetary footprint of what we are doing and what our customers are doing. And this sustainability perspective brought us to thinking twice about how we can improve the impact of what we're doing to the global health and to the global goods. And family planning was a no-brainer to focus on that. So we started to reinvest certain profits we gained from our supply activities into the ecosystem, and we're looking for something which is creating impact at scale, because we wanted not we were not looking for shiny window dressing projects which look nice at our website. We were rather looking for something which is creating impact at scale, because that is what is more genuine, and what even the investors, the shareholders would appreciate. Nowadays, you can't get away, regardless in which sector you are active in a business, without making sure that you have a clear agenda on sustainability. And health and family planning is part of that. So when looking for that, to create impact at scale at the family planning area, we stumbled over the program from Johns Hopkins University, the TCI program, and we didn't know at that point in time that this is a platform approach. We just learned by and by when we went along with the organization. And the first thing which attracted us was that this program was able to create family planning support for clients, for women and girls across many, many cities and countries at a big scale. But I think we will listen to that and learn about that even more.
Thank you, Frank. And so we will get back to you with a couple of questions. And so Biru is the next setting to Frank's left. Mr. Biru Alemnu is an online training manager and continuous professional development coordinator at the International Institute for Primary Healthcare, Ethiopia. He's a technologically inclined health professional, educationist, and public health expert whose experience is mainly focused on digital learning, curriculum development, and public health. He got his master's in health professional education from the Addis Ababa University and his Bachelor of Science in Public Health from Debre Marcus University. Biru, over to you. Can you introduce your organization and how it is operating the platform approach?
Thank you, Kojo, for the kind introduction. So I'm here representing the International Institute for Primary Healthcare, Ethiopia, which was established in 2016 by Ethiopian Ministry of Health with a seed funding from the Bill and Melinda Gates Foundation and a technical assistance from Johns Hopkins Bloomberg School of Public Health. So this institute was initially established or conceptualized as a platform which aims to strengthen the Ethiopian primary health care system, which is counted as exemplary by or like a great contributor to meet the Millennium Development Goals. And it aimed to share the lessons learned from this exemplar primary healthcare system or Ethiopian health extension program to other low and middle income countries to succeed in achieving the sustainable development goals. So our institute envisioned to become a center of excellence in primary healthcare area, and our mission is to proactively engage the advancement of primary healthcare as a means to achieve universal health coverage. So our institute serves as a platform and works in 4 main strategic pillars. So we have this national primary healthcare pillar, which works to strengthen the national primary healthcare system by creating a national platform to strengthen the leadership and the governance in the country, in the healthcare system. So we work highly with different stakeholders to strengthen the leadership and the governance of the healthcare system in the country. So when I come to the global primary healthcare pillar, we create a platform to facilitate experience sharing visits and experience sharing tools like the committee of practice, and also to enable the South-South collaboration among low and middle income countries in Africa and beyond. In this program, we have facilitated a training of more than 16 African countries so far. And, it's not like offering a training to one country or something like that. Rather, it's about creating a platform in which we will learn from another African countries, and others will also learn from our best experience. And during that experience visit or during that training, there will be also exchange of lessons learned from trainee countries as well. So it's basically a platform to facilitate learning between different countries. The other strategic pillar that we have is knowledge generation and management, in which we create a platform to do implementation research in primary healthcare. So we collaborate with different stakeholders, including universities, professional associations, and others, to generate evidences for policy translation and primary healthcare programming. And also we have built a a resource center on primary healthcare, which can serve as a knowledge base for primary healthcare programs around the world. So we have collaborated with different universities and institutions around the world to collect resources and disseminate different findings, so that every stakeholder can contribute to build these resources, and also to utilize these resources to affect the primary healthcare policy and programming. And finally, we have this PHC advocacy wing, in which we create a national and international platforms to advocate for primary healthcare as a means to achieve universal health coverage. So, I'm here because International Institute for Primary Healthcare is doing all this through a platform approach, and to share how we are achieving our goals through this platform approach, rather than like the traditional project one. So we have formalized that we have this 5-year strategic plan for now, and donors come and will fund some part of this strategic plan, but we have developed a business model to sustain like majority of our activities by cost recovery means, and we are doing or like acting to address meeting our goal through this approach. So thank you.
Thank you so much, Biru, for exposing us to my PhD. Would like to know a little bit more about that and how it relates to the whole like primary health care area implementation, etc., and how the platform approach works. I'll move on to our next panelist to the left of Biru, Dr. Maheen Malik, who's a Deputy Director at the Challenge Initiative. Dr. Maheen Malik is a senior faculty member at the Department of Population, Family and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. She's a medical doctor by education and over 20 years of experience in providing technical leadership, multidisciplinary technical advisory, strategic design, implementation, and M&E services for health programs in developing countries. Her breadth of expertise covers the area of family planning, maternal, neonatal, and child health, tuberculosis, HIV/AIDS, service delivery, and pharmaceutical supply chain management. Currently, Dr. Malik is the Deputy Director of the Challenge Initiative, a platform to rapidly scale up proven high-impact family planning and adolescent and youth sexual reproductive health interventions for the urban poor. She started a career as a medical doctor working in clinical practice over 10 years. Maheen has extensive experience working in countries across Africa and Asia. Maheen, tell us about the Challenge Initiative and how it is approaching the platform idea.
Thank you, Kojo. So yes, the Challenge Initiative took a bold step back in 2016 when people were only talking about projects and platforms. And we said that, we are not going to go towards the project approach. We will take the platform approach, such that, we provided a platform where it's not just the governments and donors who can buy into this platform. It is organizations who join this platform. The cities have to self-select buy-in and lead the implementation of the family planning and AYSRH program. At the same time, we create cost efficiencies by even asking the other donors if they want to buy into this platform, where we do the system strengthening approach. The systems within the cities are ready to layer any other health area. For example, we started with family planning, but then AYSRH became a need in a few countries, and we realized that, since the system is so ready, it didn't take us the equal dollar amount to do the AYSRH. It took us very little amount to just layer the AYSRH component. We have hubs in India where one of the donor was interested in MNCH, and so we were able to layer MNCH to the same platform and do it. We started with just 4 hubs, East Africa, Francophone West Africa, India, and Nigeria. And very soon we realized that there was a need and a request from Philippines, which is when Philippines joined us. And they didn't just join us, they joined us with the Zulik Family Foundation, who was willing to put their own money towards this initiative. So it was a different approach because then they were able to make their own dollar amount contribute to what TCI was doing. Very recently, we have been joined by the Pakistan hub. And so it's the same. And we thought that, the time that we started Pakistan was a lot of political unrest. However, looking at the results from the other countries, we saw an overwhelming response, and the cities started to buy in and wanted to partner with TCI. How we do it is, as cities self-select to be part of this platform, they lead the implementation of the work. And what TCI does is just provide technical assistance and coaching and a seed amount, which we call as Challenge Fund, which helps to demonstrate the impact of the proven high-impact intervention. We were at a pre-conference yesterday, and somebody asked, what is TCI University, where you have all your approaches housed? Is it a brick and wall university? So TCI University is an online university. I request all of you to sign into TCI Urban Health. There's a TCI University. You'll find the best approaches that have worked around the globe that have been tweaked to best suit the needs of the local cities. And the government uses those because we strongly believe in the 80-20 rule. We say that, do 20% of the work and get 80% of the results out of it. We have a very robust monitoring evaluation system where, again, we built the government monitoring evaluation system rather than establishing parallel program implementation or program monitoring information system. What we strongly believe is, as cities get into implementation, the system is strengthened. If we could strengthen their own monitoring evaluation system, it is there to remain. But I'm happy to answer any questions that people have.
Great, thank you very much, Maheen. And yes, we'd like to dig a little bit more into the thinking behind the platform and the principles of the platform and what makes the platform approach be a more advantageous approach compared to the project mentality. So thanks, Maheen. And with that, we move on to our last panelist, but not the least, Mr. Raymond Zing of the Asia Pacific Anticipatory Action Coordination Team of the German Red Cross. So Raymond Zing has been working with the German Red Cross as the coordinator of the anticipatory action in Asia Pacific since 2019. He's also the regional representative of the Anticipation Hub. He has national, regional, and global experience in implementing anticipatory action over 10 years of experience working for the Red Cross, Red Crescent movement, as well as the United Nations. So with that, Raymond, take it away and tell us about the Anticipation Hub, and tell us how the German Red Cross is basically proceeding with the platform approach. And then we'll take on some questions after that. Over to you, Raymond.
Good. Thank you so much for having me. Yeah, it's great to be here as a humanitarian organization, and I probably want to talk a bit about what is anticipatory action, just to give a bit an idea what that means and how it then connects to the platform approach. Anticipatory action is basically an early warning, early action approach, meaning that we want to help vulnerable communities to reduce the impact of a natural disaster, such as floods or typhoons or heat waves and cold waves, before it happens. And for that to be able to really work, we need 3 building blocks. It's normally, we need to have good risk information. So it's a forecast that tells us, okay, something is going to come. It's a flood or it's a typhoon. But it's not just that. It's not just a forecast what the weather will be. It's going to be what the weather will do. So for example, we don't care about 1 meter of floodwater. We care how much damage does this much floodwater do in a particular area. It's very different in an urban setting compared to a rural one, right? For example. But for that kind of understanding of vulnerability and exposure, we need to have that information before a hazard approaches. So that it requires quite a bit of technical knowledge and expertise. The second building block of anticipatory action is the anticipatory action itself. So what kind of actions can we do that really help vulnerable communities to reduce the impact? So let's say, for example, for livestock, what can we do for those livestock or for agriculture before a typhoon comes or before a flood? It can be evacuations, it can be early harvesting, it can also be cash. So what are the most effective actions that we can implement before it happens? And that is very challenging because we have normally a very short lead time. From a forecast to the event happening, it can be 3 days, it can be 30 hours, or it can be 10 days, depending on the hazard, right? So that is quite challenging. Plus then the third building block is the financing. So we need to have the financing in place. It is ex ante financing, meaning that we need to have everything agreed. Everything is pre-agreed, pre-arranged. Once we have a forecast that reaches our trigger, the money is released. We don't have to wait until it happens and then say, yeah, okay, let's allocate some funds. This is all done beforehand. So that is a bit the anticipatory action approach and how it connects to the Anticipation Hub. The Anticipation Hub is an initiative of the German Red Cross, the International Federation of the Red Cross, Red Crescent Movement, and the Red Cross, Red Crescent Climate Center. It is supported by the German Federal Foreign Office. But it's not a Red Cross, Red Crescent exclusive platform because it brings together more than 100 organizations. Now we have, for example, governments. We have ASEAN, the Intergovernmental Organization for Southeast Asia. We also have a lot of the United Nations organizations. We have, of course, Red Cross, Red Crescent national societies. But then we also have, for example, NASA, the space agency, which that is also part of that platform. The Anticipation Hub really brings together everyone and everything that is connected to anticipatory action and the 3 building blocks that I mentioned. So it can be something about risk analysis. For example, NASA, they're more interested in Earth observation and satellite data, which is really interesting. Others then are more interested or more connected to a different building block. So I think the platform approach that we have is also quite interesting because it is constantly evolving. It's anticipatory action is an approach that there is always something new. There are new ways of doing things. There are new research. So that's what keeps that kind of community together. And I think that's what I also like about this conference here is that you really feel it's a community here, right, of family planning. Similarly, we have a community that works on anticipatory action and that comes together on the Anticipation Hub. Because the Anticipation Hub, on the Anticipation Hub, if you want to go there, it's anticipation-hub.org. And there you can learn everything about anticipation. We have, for example, a database on triggers. We have a database on early action. So you can go there and say, okay, I want to do something on floods in this sector, in this country. Let's see what other people have done. And I think that kind of approach that brings everyone together and allows that kind of knowledge sharing really helps to make sure that it is not just a project or donor mandate that the Anticipation Hub, I guess, wants to promote, but it's really that kind of community that we want to further approach. Yeah, maybe I should leave it at that. But then maybe later I will talk a bit more about anticipatory action and health, which also goes into family planning.
Thank you, Raymond. And we do have a good idea about the four organizations and why they subscribe to the platform mentality. I like to highlight a few points around the platform idea. It's either the platform approach or the project approach. And the project approach usually, as we all know, it's kind of like siloed in the sense that it is time-bound. It is usually probably by one donor. And then the objectives are very clear for which one runs the term after which it falls off a cliff. And usually sustainability becomes a challenge. Now, the platform creates flexibility. It still dwells on the same objective, but then what happens is that it allows other players to join. It results in cost efficiencies. Also, the knowledge that has been built within the system helps really for one to easily scale up in other locations. And so I'm going to give an example of if, let's say in a country, there are 10 regions in the country. And if the project basically was looking at 3 regions and it was very tailored towards that, the funding was finite, it was for 3 years, you do it over the 3 years in 3 regions, and that's it. That is a project. When it's a platform, what happens is that other players, even local partners, local NGOs, governments, universities, who have the same mandate and have the same vision can join. And what happens is that it allows us to be able to extend the object further geographically, deeper, bring in and really spin the idea of making it sustainable for the communities out there. So this is what I'm hearing coming from you, and I would like to go a little bit more into that. And Frank, you started by talking about the fact that Bayer is an unusual donor, and absolutely, I mean, based on where you're coming from. You also did mention that you were looking at impact at scale when the decision was taken to co-fund TCI. The capacity to scale up seems to be an important feature of the platform approach, and I just basically alluded to that. However, that might not be all. What else would you expect from a platform approach, specifically in reproductive health, being in a conference like this that is focusing on family planning?
Yeah, thank you. The impact at scale is certainly something which works nicely on a platform approach. But of course, you can even have big projects which create a lot of impact. That might not be the differentiator. Perhaps I can talk about that by talking about my visits at the TCI projects. So when we first started in 2020 with that, the TCI program was so nice to invite us to different places. And me and my colleagues have seen the programs. And it was stunning to see that there is a mix of common denominators and individualization. That's one thing. So there are principles which are everywhere the same, while at the same time, it's absolutely individual and tailor-made to the local situation. I mean, example, when I was in Nairobi County and we saw the settlements there, we first went to the local municipal government. And what struck me the first was that the officer there responsible for the health activities in their sector and their territory, they explained to us their program. They did not talk about a donor-funded program. They did not talk about TCI as something which has been invented elsewhere, and they just apply it. It was their program. Then we sat in a round where all the other stakeholders were there. The head of the pharmacy association in that region, people from the school engagement, and they talked about their TCI program. So there was a broad ownership, and having these platform approaches, bringing people from different aspects, from different angles together, has the opportunity to create that global ownership. That was, and certainly it's something which was not clear to me in the beginning to that extent. When we visit the hospitals, of course, the same. We were there, and the leading nurse explained to us how they do the family planning programming and the universal referrals, so about vaccination and HIV and family planning. And they were talking about their program. It was the very same program, but a lot of owners. And that is something which you typically don't have in a project. That's really something what creates a lot of energy. So besides the impact, I would also call out that platform approaches have these the chance to create the impact also at a very high quality, because people are really in it. They believe in it. It's their program, and it's not nothing vertical which comes from either donor or implementer. Even this is a multi-layer approach. You know, you have, of course, the programming, the Johns Hopkins University, you have the hubs, but finally the people on the ground, the grassroots, they need to own that. And I think that's one of the unprecedented benefits of such an approach.
Thank you, Frank. As you were speaking, Frank, what came to mind was the fact that so the platform approach really is not about, say, an organization per se. And it's not about an organization's objective. It's about an idea, a vision, a concept with a joint vision towards achieving objectives. And you know how we kind of like protect our turfs when we are running like projects, and it's about how you put forward sometimes the organization that is doing it. But I think what happens with a platform is the fact that because there are multiple players, and the essence is not really about what that organization achieves by itself, but opening up to as many as possible to join, it makes it agnostic of an organization, and therefore the ownership on the ground then becomes real, rather than having it such that we have clear project objectives for which an organization needs to execute. So, as we all know, in the area of development, that local ownership is becoming critical. And I think that kind of approach, where the local organizations that are the receiving and actually taking hold of this can feel a part of it. So, Frank, that is what I'm getting from it as you talked about the ownership that you saw at the level in Nairobi County in Kenya. Drew, so in terms of how utilizing the platform approach in strengthening PHC systems, what recommendations do you have for those working in family planning, in the family planning area, to adopt the platform approach? So yes, you are looking at it on a broader area of primary health care. Any thoughts about how those of us here working in family planning can pursue the platform approach based on your experience?
Yeah, thank you. So from our experience using the platform approach in strengthening primary healthcare systems in low and middle income countries, let me start with what we are getting from this platform approach. Since our establishment, we have been sharing our experiences, advocating for primary health care and things like that. But building a healthcare system, a strong healthcare system, in general, like as primary healthcare, or like building a system that can like effectively enhance the delivery of quality RH services or family planning services, I think is not bounded by a short period of time. And I think it's not something that can be attained by involvement of one sector, or like a program in just bounded with time, bounded with like some donor, something like that. So, using the platform approach enables us to attract more partners who can advocate for primary healthcare with us, who can contribute by generating evidences that support policy making and programming for primary healthcare in different countries. And also it helps us like to expand our working areas when emerging issues like COVID happen. As you know, for example, when COVID-19 comes, it becomes a huge obstacle to strengthening the primary healthcare system. It even distracts what was built in like to deliver the essential healthcare services, including family planning services in the area. But since our organization or our institute was acting or working as a platform, we just incorporated COVID as one of our working area, and we try to build capacities to create resilient primary healthcare systems in the COVID-19 era. So I think family planning was also affected in the same way as building healthcare systems by emerging issues like COVID. And I think working or adopting platform approach can help us sustain such challenge, and also expanding or incorporating things like that to continue providing quality service. So by coming to the platform approach, we have created a community that can advocate for primary healthcare. We have built a resource center that can be an asset for anyone in the world who is trying to build or strengthen primary healthcare systems. So I think programs in the family planning area can also like adopt this approach to build a community, a local community that advocates for family planning based on the norms, the values in the locality, and also a global community that advocates for primary health care, for family planning, as this conference. So these are my recommendations, and from the benefits we got from the platform approach, I highly recommend others to try this approach, I think.
Thanks, Bu. And so we're getting some lessons there. Maheen, following up to that, you did talk about the platform model supporting TCI's ability to scale. Have there been any lessons learned that can be helpful to others considering this approach in terms of scale up? So some practical lessons that you've learned, because really in the midst of it, I'm not sure it was hanky-dory, even though it's a great model, but there must have been some challenges and lessons learned there. So any lessons regarding how it impacts on scaling up?
Yeah, my first lesson learned was the day I interviewed for this position, which is when I asked, how long is this project active for? What am I joining? When am I going to, be out of job? And the then director told me, what project? And I said, the project that I'm joining. And he was like, but you're joining a platform. And I was like, not sure what he's telling me, that I'm joining a platform. So Frank, you weren't the only one who didn't know that you're funding a platform. Even I didn't know I'm joining a platform then. But then over time, yes, when I joined the TCI platform, I realized that It isn't something that is going to end. It isn't something that has a finite scope of work or a finite funding amount or a finite area to work in that, so my suggestion would be that, as Frank was mentioning, locally owned. How do you make the governments own this program? That is how it can be sustained. That is how it could become not just something that, people know, a project has come in, it has a finite period, it has this scope of work, and that we are going and doing this work. When the governments buy in, they are the ones who are implementing, which is very critical because even when we walk into government offices, providing them on what the information on what TCI is, that is the question, what do you want to do in our city? And we have to tell them that, it's not that we want to do anything in your city, we want you to implement, we want you to lead a program that is led by you, a program that is designed by you, something very similar to how we define democracy, that of the people, for the people, by the people. So it's a program which is of the government, for them, by them. So the ownership and the buy-in has to be critical when we have to go for platforms. It has to be cost efficient so it can be scaled. It doesn't have to remain as a concept. It is something that people have to believe in and live. Because if it remains as a concept that, yes, there's something platform that we have to do, they will still go by what is defining that whole platform. So to be innovative, to think out of the box, is to believe in it, is to live it, is to create efficiencies and innovations within this. You mentioned that, yes, it's different organizations joining. Same is for TCI, while, and Frank also touched on it, that, meeting these organizations, they have their own organizational agenda. But at the same time, how do you bring even these different organizations on the same concept to believe into the same objective, that this is what we plan to achieve? We have about 180 cities that have joined this TCI platform. How to make sure that you go to individual cities and 180 cities are speaking the same language, are using the same evaluation methods to track their progress. How do they implement with those same principles? Yet at the same time, as I mentioned, the TCI University, we tweak it to the local context such that there is ownership. That if there is a health worker who's going out, she is sitting, say, in a city in say, Kenya, who would see her peer to appear on those high-impact interventions, her photograph, for her to own it, not to see an Asian woman who's being served, who's being given services. So to that extent, we ensure that, we are, and continuously apply learnings. So if you get fixed on one thing, it is very difficult. So that is how I would just say are a few things.
Great. Very practical ways by which the platform can be actualized. There was once that I was thinking that, are we going to be seeing an era where communities, districts, countries come up with a very clear objective of what it is that they want to achieve, and then basically shop it out there in terms of inviting folks to join the platform? So you see, we do it in different ways. I mean, our ministries of health, our population councils and what have these plans. And yes, they reach out to the donors and reach out to communities to contribute to it. But I think that intentional way of structuring it such that there is a focused vision and how people that may be of different origins can come together and feed that particular objective, and it not be just probably for 3 or 5 years, but feed a longer term vision of the region, of the community, of the country, of the council, or of the ministry. And I think really that is what I'm hearing from here, that it's really about a movement around a vision rather than it is about just a concept. Okay, so thanks, Maheen, for that. Raymond, with over 100 partners, and I think that's really critical. I mean, obviously, you have 100 partners and you have to herd all of them. I mean, how does the Anticipation Hub ensure continued commitment and interest in sustaining the platform?
Yeah, thanks. That's a good question. Yeah, I think it is a bit what I mentioned before, right? How do we make sure that partners stay engaged? And it's probably echoing what we've already heard. It's about staying relevant, evolving into new areas. But it's also making use of that kind of momentum that we have. And this traction has really taken off. It's a new approach that is not only in the humanitarian area, but now also expanding into development and other sectors. And for me personally, it's about also capacity and scaling up. I don't have the capacity to support all these new partners and countries, right? But because of the platform, because of the anticipation up, we suddenly have much more capacity, much more knowledge and resources that we can share with partners. There are, for example, new countries that want to implement anticipation, and they come to us and say, well, so how do we start? What can we do? We don't need to have a project in country, right? We don't need to set one up, and we don't need to have that kind of human capacity and money in country, but we can also refer to the anticipation hub and make sure that the learnings that we have from the country, from different from the national level, but also from the regional level, can then be adapted to that specific context. And I think that is equally important because, of course, every country is different and they don't always do things the same way. So I think that kind of, and probably that has also been quite a success for the anticipation of, to really extract that kind of knowledge from the national level and then make sure that it is adaptable. So not just to say, oh, this is the example from Bangladesh, make something out of it, but really to make sure that, okay, these are some of the core maybe elements or aspects that you should look at in your country, in your context, and then adapt that. So for me, that's really one of those. Yeah, and then it also comes again back to being locally owned, right? That's again what we heard. The anticipation hub then again allows that it's various actors at the local level. It's not just national governments, it's also local government units who can make use of that. In the Philippines, for example, local government units have advanced anticipation also because of advocacy messages that we have developed at regional and global level. So I think that kind of trickle down, maybe, I don't know if I want to say that, but also that locally owned approaches has been really successful, I believe.
Great, thanks, Raymond. And so, Raymond, would you say that the German Red Cross acts like an aggregator for all those partners? Is the reference point the German Red Cross?
To some degree, yes. Yeah. At the same time, I would say the anticipation hub is made up of so many different core partners, right? That I wouldn't necessarily just want to say it's the German Red Cross. But yeah, that we have that kind of core partners who really drive the agenda and drive the new approaches that we want to promote. Yes, in that sense.
Yeah, and to Maheen, just a follow on to that. Again, with TCI, so can you talk a little bit about the role of the aggregator in terms of how the reference point for this kind of partnership?
Yes, and so, there has been recent debate about going local organization, going international organization, but I believe no matter which direction is taken, there still has to be a central party that should be able to, because as I was saying, each one of us have our own DNAs. How do you make that slight change in the DNA such that, the different organizations, the different countries and cities are able to adapt? It's very difficult to make organizations learn from each other in a friendly way. Each one of us, you mentioned, we have our own turfs. We don't want to. How do you make that happen? It is if there is a central global aggregator that can help start this learning process amongst organizations, ensuring how even these governments, I'm talking about Kenya, and then I go to Francophone West Africa, I go to Pakistan, but how do you make these cities, even up to the subnational level, implement the way things are being implemented in Kenya? How do they get implemented in Karachi? How do they get implemented in Agra? That is, if you have one central who can help them learn across, I think even for donors, it is easy to invest into one organization, and they are then responsible for ensuring that, there are so many other requirements, not just, I wouldn't go into financial and audit requirements, but there is, where do the learnings get documented? How are these learnings shared in different cities? How do these learnings get shared widely such that people can build on it? TCI strongly believes that, there's no problem in failing. Fail fast, learn fast. Move, do course corrections. But for this learning, and if it is only one city, one organization that is learning, it will take its time to learn its lesson and then do course corrections. However, under TCI's platform, we are able to offer this that, you can even learn from other cities that may have certain course corrections that may have failed, may have suggested how to overcome those. And so I guess that's where the global aggregator sits.
Great. Thanks, Maheen, for that. And I guess what it is that when different organizations come to the platform, though there might be a central point that is kind of coordinating it, partners can come with their resources. They can come in a space of leveraging each other's resources under the vision to push the idea forward and work towards the same objective. And so as the whole thinking of the platform evolves, it will be interesting to see the role of an aggregator. How does that enhance or rather prevent others from coming in? But what is the posture that an aggregator takes to be able to attract others? And Maheen, you talk about DNA. Yes, different organizations have DNAs. So now the question then is that the platform then should have its DNA, for which different organizations coming together then mutate, and I'm using your DNA, mutate to become, to have a DNA that is common to all, even though you may have your own DNA. So let me follow up, Frank, from a point in terms of basically, from your perspective as a pharmaceutical organization, private sector, and yet at the same time, also being a donor in this space and looking at subscribing to the platform, what do you think could attract other private sector stakeholders to join? And what might be the obstacles to overcome? If, for example, there is a platform either like that of the German Red Cross, like that of the Primary Healthcare Institute, or like that of TCI, what really will be attractive to other private sector stakeholders to join? And if you can also touch on any obstacles that could prevent them from coming in. Thanks.
Yeah, sure. I mean, we are not the only donor of TCI, obviously. There's the Gates Foundation, there are others chiming in, and I would love to see more donors coming in from all the different sectors, and even from peers and even competitors. And that might be, starting with the obstacles perhaps, that might be the challenge that, of course, a donor, depending on what their objective is, sometimes the objective is to showcase that this is my project, this is what I support. Particularly when I talk about the private sector, the commercial sector, there's a lot of window dressing, showcasing. That's part of the reputation management, to say it more nicely. And then, of course, management is easily on the track to say, let's do this as our project in order to showcase that we are doing good, which is very short-sighted, because in the end, people will fully understand and see the difference between a window dressing exercise and something which has a serious long-term intent. And I think when we focus on the objectives, when donors focus on the outcome, then they have to be open to be a co-donor and to find a broader platform of donorship instead of having this proprietary access model or support model. I think that's the obstacle, and in the same time, it's also what should attract, because by that way, you not only graduate the cities in case of TCI, where you have a certain period of time where they are supported and it goes into the light touch, and they still deliver on the KPIs, on the outcome. That's great to see, but the same could happen with a donor platform. The bigger it is, the more donors can come in and go out again without being disruptive. I mean, that's one of the biggest challenges in such a donor-funded system, that once the donor goes out, everything collapses, which doesn't happen with the platform. So the reliance, the sustainability, and the resistance against crisis is something which is much more attractive, which should be attract donors much more than nowadays than before. So we should have learned over the last years, and still learn in the geopolitical crisis, that resilience is much more important than a quick success. So I would rather go for that. And perhaps another comment, which I also, when I observe and compare the platform approaches in the development area with what we do in a general management, to keep people together on the same track, to make sure that the quality of the outcome is comparable, you need KPIs. And that was something which I found quite impressive also when we started working with TCI, that there is a high level of efforts to make sure that the outcome is tracked. If you don't do that, then easily it runs into different directions. And it's not helpful to push more on the methodology to say you have to do it that way and that way. If you don't track the outcome, it doesn't help. So there's a certain effort. And actually, when I look into the budget lines, the effort for tracking the outcome is significant. When I compare this to a launch campaign in the pharmaceutical industry, we would rather put the money up front before the launch, and then when a project is running, we would say, okay, let's see what the final outcome is. But the efforts to track that and to refine that is significant. So that might be also something which unusual donors like us have to learn, that this is absolutely necessary for sustainability.
Great. So, I mean, great points in terms of the perspective of donors and private companies. Biru, I'd like to take you back a little bit, because I did hear you talk about the fact that from the onset, your institute took the platform approach. What would you say were the major factors that led to the conceptualization of your institute as a platform from day one? Because I'm looking at the fact that the audience may be thinking about, how do we take off? So what were some of the factors that were there that made your organization think from day one to go in the platform direction?
Thank you, Kojo. I think that's the best question. So I think our institute was founded as or established as a platform because, creating a strong primary healthcare system, creating a strong healthcare systems at all is about creating a resilient primary healthcare system, which cannot be met under a short time frame as it's common in traditional projects. And also, I think creating or building a resilient primary healthcare systems is, it needs a lot of stakeholders to collectively come and work to meet that goal. And that cannot be supported by a traditional project approach, rather than it should be about creating a room to call all stakeholders to come and collectively act on building resilient primary healthcare system, and also with all the emerging issues in the system. So I think that's why it was established as a platform from the start. And also when we talk about sharing lessons, taking lessons from others' experience, others' good and bad experiences, I think it needs like the involvement of the government, the involvement of all partners working in the health sector in that country, something like that. So when you come to our programs, every partner, every non-governmental organization, international and local ones, will contribute to our programs, our trainings, our experience sharing visits, and things like that. So when we see from this perspective, this couldn't be done with the traditional project approach, which is mainly funded by one donor and also implemented by like just us or something like that. So I think these factors led the establishment of IPHC as a platform. And also this platform approach like supports like having different projects in layer within us, which is a typical like nature of a system building. So when we talk primary healthcare systems, we talk about leadership, about healthcare financing, about community engagement, about human resources for health, and also maybe like all the building blocks of health systems will be covered in like strengthening primary healthcare systems agenda. So, you know, we were able to do all this with different stakeholders in the area, and this needs to attract different partners to be like a reality. So I think these factors led the establishment of IPHC as a platform, and this really helped us to achieve our goal of strengthening primary healthcare system in the country, and also in supporting other low and middle income countries to build or to strengthen their primary healthcare system using all the partners around us, which are called by this approach of a platform. Thank you.
Thank you very much, Biru. And so, the audience, you have some cues as to some of the thought process in terms of what you go through as you're considering this platform approach. And there are various examples here that you can take out of it. I'm wondering, maybe we might have some questions from the audience. And so I think I'd like to take a question or two before we run out. Can we start with, I can see Dr. Rab. If you would probably walk to the mic at the back, and I'll take a second person after that. So let's start with Dr. Rab, and if you can direct your question as to, or whether it's to then all the panelists, please.
Okay. First of all, I would like to congratulate TCI for arranging this wonderful. My name is Aziz. I represent Green Star Social Marketing Pakistan. And thank you, John Hopkins and Gates Institute for providing this opportunity. My question is to Frank. Our linkage, Green Star's linkage with Bayer, for example, has been for 30 years with Famiject, Novaject, largest number of service providers trained in Pakistan to use Jadel. Marina is one of our products. So we are very happy to be part of TCI because it is already helping us engaging and capacity building and strengthening government, because they are here to stay. They are the leaders. They are going to scale it up. However, here is the opportunity. 60% of the population goes from out-of-pocket expense to the private sector service providers. And in this, ever since we have been with TCI, we have been approached by Roche, for example. They would like us to use our 13,000 service providers all across Pakistan to create awareness about breast cancer, early detection of breast cancer. Nutrition International wants to come to us because of TCI platform, because there were floods, diarrhea was killing. They wanted us to do the job in the private sector for providing zinc and ORS. So here is my question that would there be an appetite if we come? Because while we are doing with TCI whatever we are doing in the public sector system strengthening and capacity building, here is a very large private sector whom we previously worked with KFW for almost 20 years, which is our flagship project, to create a resilient ecosystem in the private sector with various areas. For example, capacity building, for example, solarization of their clinics, waste management and training. So socio-economic conditions are very bad. So we are training them for social entrepreneurship, private sector service providers to expand their business because that's where the population is going. So is there an appetite in BEAR for the private sector
Right.
as well?
Thank you.
Make sense?
Okay. Over.
Yeah, thank you. I think that makes sense. There is one aspect of platforms which we haven't discussed yet, and I think you touched on exactly that point, which is efficiency. So you would go for, if you want to launch a new initiative, if you want to reach people in what regard soever, and you have an existing infrastructure, you will be not very smart if not using it. And it's so difficult to build up an infrastructure and maintain an infrastructure. And once you have that, that's absolutely a no-brainer to go then there and use that and multiply it, which is the next level of platform approaches, which we haven't reached yet in too many cases. Yeah, so that's something for the future. There are some instances I learned that TCI is also working on maternal and child care in some areas, and on a completely different platform, we are just, as we speak, we are discussing implementing healthcare services for cardiovascular and touching that and using same touch points like for HIV. So when there is a platform, when there is an infrastructure, and Gavi, HIV, these areas have created those already. That's another example. We should try to use them for the other purposes, which are as important as the others, as the already existing. I'm not sure if BEAR is interested in joining Roche in the breast cancer thing. That might be interesting. That is something which is at least on our agenda as well. And we're doing a couple of capacity building projects in the Middle East and Northern Africa for oncology. But once this opportunity is there, there is a broad range of potential donors, and we should strategize around that, how to bring these donors to the platform. That's certainly the second level of platforms.
Thank you very much, Frank. So I have exactly 5 minutes to wrap this up. I see there are many hands. You know what? Please, if you can ask your question in 40 seconds to a minute, and if I can get a response in a minute, we can do that. And please say who you are and where you're from. Just go on, speak. Uh-oh, we can't hear you.
Sorry,
we can't hear you.
Yeah. So thanks to all the panelists for this great discussion. So I have a very small question to Frank and Maheen. So we are experiencing the platform, especially the TCIC platform, but it's very obvious that we feel that marketing of platforms that it is available and multiple health categories can be layered on is still an area where we should work more. So my question to Maheen and Frank is how to do the marketing of platforms so that its visibility is more higher for the donors, investors, government, that okay, this platform is available, this platform is functional, and this can be used for layering on multiple health categories to ensure universal coverage of health.
Great. Thank you. Okay, so Maheen is about how can we market the platform?
Mukesh, I totally agree that perhaps we missed the mark on advertising the platforms. However, We have started to, for example, yes, with the donors, we will be requesting for assistance from the donors. In terms of us, I guess it's all of us, we have this responsibility. So where I say we missed the mark was we were so focused in getting the platform operational and getting the platform successful that perhaps we didn't document a lot of it. However, I'm happy to announce that there are at least 20 manuscripts coming out as the Global Health Science and Practice Journal. That is one way for people to understand. How do we market it at international organization, conferences? Is where perhaps, because now this is very new to many people, the platform concept. People were still into projects. So that to me is the way forward.
Thank you. And Frank, you want to make a comment on the importance of marketing the platform? It's an absolute necessity, but any comments on that?
Rather asking the Red Cross colleague how he managed to get 100 supporters into the platform.
Yeah, that's a good question. It is, of course, good advertising and advocacy. But what I actually also wanted to say, the platform approach is really good for efficiency, as you mentioned. We do the same work because it's funded by projects and different donors, and the platform approach somehow, at least partially, tries to remove that. I'm working on doing a trigger for floods. Other organizations in the same country do the same, because it's a project, because coordination is difficult, but the platform approach can help with making that a bit better, I guess. But yes, how to advertise that, right? I think on the one hand, that's one point. It's also return on investment. I guess it's much better with a platform than a project potentially. Yeah, and then outreach as well.
Right. Well, I mean, thanks with that. I'm sorry. I wish we had some more time to take some more questions and contributions from the floor. I see that even though I'm saying that, this gentleman here still has his hand up. If you can run to that place in 3 seconds and you can ask your question in 5 seconds, we'll answer in 20 seconds. Thank you. Right there, yeah.
So, first of all, thank you to all the panelists. I have a small comment and a question. Since TCI brought in innovation through the platform approach and was a disruptor to the conventional program approach back then in 2016 and has delivered successfully since then, my question is, what are the learnings and plans to take the TCI platform to the next level and sustain and evolve?
Maheen.
Hitesh, you shouldn't do this to me. No, well, as I said that, we started with just 4 hubs. We are already into 6. We created a platform which was just for public sector. We started to bring in private sector, and there are strong public-private partnerships that are evolving out of it, with the objective that the public sector should take ownership for this huge private sector that exists. We realized that, during the COVID time, the strengthening of the private sector that was done under the TCI and the government leadership of this platform, that there were still health service providers and pharmacies that are able to continue providing these services. So I think, as Frank even mentioned, there's going to be a second stage, a third stage. We started with just PMGF. We have Bayer join us as well as a major donor. And we are anticipating that, there will be more people who will learn more about this platform, should be able to join this movement.
Thank you. Thanks for the question. And we have run out of time. But that tells us that the whole platform approach needs some more space for discussion and to look at how we can harness it to meet some of our development objectives, and also not just basically do it because others are doing it, but we need to be able to write up case studies. We need to be able to analyze it. I really want to see a situation where we can begin to elevate it into peer-reviewed articles in terms of the case studies that are being operated there under the platform thinking. I think that in wrapping up, the platform approach reduces the kind of selfishness that sometimes also exists in our space. and some of the unnecessary competition that also exists in our space. It's true that organizations have to survive, but really the agenda is always bigger, really should be bigger than the organizations that we work in. And so from our side, and we would like to commit to continuing this conversation about the platforms, and so look out for this space. We're hoping that the learnings that we have there can be put out there for others also to learn from, and also to either evolve into that platform approach, or in fact, if starting afresh, consider it. On that note, I'd like to say a big thank you to our distinguished panelists. Thank you, Raymond. Thank you, Maheen. Thanks, Bill, and thank you, Frank. I mean, it's always great to see the mix of representation from different organizations, and even have an unusual donor like Bayer in such conversations. So with that, thank you very much. And you all have been great audiences. Thank you. And we look forward to continuing with the platform discussion.